You're watching WRAL News in high definition.
Well, coming up, it's a problem that happens more often than you think. Surgical tools left inside a patient's body, the most common being sponges. The health team shows us the breakthrough technology that assures no sponge is left behind. Plus,
WRAL's health team, coverage you can count on.
sometimes surgeons remove one problem from the body, but then leave another one behind.
Anywhere between 1 in 100 to 1 in 5,000 patients end up with a surgical tool left inside the body, the most common being sponges. WRAL's Dr. Alan Mask shows us a new system at UNC that could make that problem history.
This is a laparotomy sponge used to control bleeding and help surgeons see structures inside the body. A scrub nurse counts them to make sure none are left inside the patient, but they can be hard to find.
If you imagine this as wet and getting shrunken down and then tucked behind an organ,
it creates problems for the patient.
Most people can have chronic pain from them. They can present with bowel obstructions, or they can present with life-threatening infections.
And it requires more expensive imaging and another surgery to remove the sponge. UNC GI surgeon Dr. Christopher Roop led a study at UNC testing a new system that makes sure no sponge is left behind.
There's a small device in here that's almost the size of a little pill, or almost twice the size of a kernel of rice.
The device emits a radio frequency signal detected by a simple wand before incisions are closed.
And then as you just bring this over the patient, you can see that it gives a detection system.
Dr. Roop is hiding the device under the thick mattress.
We can still detect it through multiple different levels.
Instead of the wand, a special mat can be used.
and it has 6 zones for picking up surgical sponges.
UNC Hospitals is the first in the triangle to adopt the system, and registered nurse Stella Nelson predicts it will become the standard of care.
It is an important adjunct to the manual counting that we have always done.
Sure nice to know that there's that extra step there.
It's a genius of an idea.
It is. Yeah. Well, are there any certain surgeries where there's a bigger problem of sponges being left behind than others?
Deborah, it's more common, of course, in open surgery with large incisions, but of course it can also happen in laparoscopic surgery as well. Nurses are typically careful to count sponges to make sure all of them came out, but it still happens, and when it does, of course, patients find out, and it can lead to malpractice lawsuits. So this system can save hospitals and patients a lot of time, trouble, and money. We brought an example of the sponge here, and this is the magic pellet here, about the size of 2 kernels of corn, or rice, if you will, not really very big. And this is the device that they use, and certainly I think this is going to be a godsend.
Fantastic.
Yeah.
Like you said, a genius idea.
Yeah, you bet.
Time has come.
Yeah.
Thank you, Dr. Mask.
You bet.
Well, we have really seen a mixed bag of weather.